At Revive Me, we bring together the pioneers shaping the future of health, longevity, and wellness, as well as health tech in the Middle East. Today, we sit down with one of them, Dr. Sajid, founder of Transcend, a healthcare ecosystem designed to bring clarity, structure, and a long-term thinking to longevity and modern health. Dr. Sajid, welcome and thank you for joining us.
Well, thank you. Thank you for having me here. It's a pleasure.
Absolutely. How are you today?
I'm good. I'm doing well.
Alhamdulillah, good. So, Dr. Sajid, you're the founder of Transcend. And what really stands out is that you're not building another clinic or service. You're building a system that helps people make sense of longevity in a much more thoughtful way. You've been with us at Revive Me, at the Revive Me conference, surrounded by a lot of ideas, technologies, and conversations around health and longevity. Today, we'd love to talk about your journey, how your thinking around longevity has evolved over the time, and what stood out to you during the Revive Me event. What stood out to you basically during the Revive Me event, mainly?
So me as a practicing physician, being here in the UAE for the last 20 years and practicing longevity in the last 10 years. So we've seen a lot of changes coming up, a lot of good things. Within the space of longevity also, a lot has changed in terms of diagnostics, what treatment offerings are there, government policies and changes over there. And in the last couple of years, it has rapidly increased. Well, change is good. It's all for the good. But it has also caused a lot of confusion amongst the people that what is right for them and what is not. And basically that was the main idea why we started Transcend Health. That is to guide the people into the best space for longevity and things like that. It's from both the sides. It's for the providers and for the consumers, so they understand well. And at Revive, or events like Revive, which is like longevity events and all that, give us a platform to showcase what is there for all the people and to come together to understand what other people are doing, what the consumer needs are there, what is happening around them. So overall, it was a great platform to be at to Revive Me. And I think and hoping that we have such more platforms so we can share ideas and also represent ourselves.
That's lovely. So you tend to simplify the longevity protocol for patients and people out there.
Yes, we try to listen to them, what their needs are, and then customize it based on what their needs are and not what others are offering, and then what's right for them and guide them where to go and what.
That's awesome.
Yes.
And for anyone who didn't get a chance to meet you at the Revive Me conference, excuse me, how do you usually explain yourself, who you are and what you're building at Transcend in a simple, wholesome way?
Well, what at Transcend we're trying to build is an ecosystem of great longevity physicians, longevity centers, longevity retreats, and everything, which will help us to process and simplify the process of a patient or a client looking at a longevity journey. So it is just building an ecosystem and not working against anybody. So we want to partner with people. We want to have that connection. So we make the longevity journey simplified for our clients.
So you said retreat. How many days is the retreat usually?
Well, it starts from, you basically need at least a minimum of 3 nights to at least experience something in a retreat, which we work with. And it could go from 3 nights to 28 days. It depends on what program you are in and what your needs are.
So it's different from patient to patient?
Yeah, patient to patient. If someone is going for a weight loss program, you're not going to see any changes. You'd have to have a minimum of 7 nights at least to be there.
I see. And doctor, you spent many years working in internal medicine and critical care across the region. At some point, your focus clearly shifted. What changed for you, and what made you step away from traditional practice to start thinking more towards the direction of longevity?
Well, yeah, I started my career as an intensivist, worked in medical ICUs, saw critical patients. We had critical conditions both at all kind of age levels and all that stuff. But what I realized is that by the time they're in an ICU, it's too late for them. Things can be preventive. Like I always say, these chronic medical conditions don't just come up suddenly. They're grown over the years. Mm-hmm. And we try to neglect them or delay their treatments or even to checkups or things like that. And that's what I realized. I myself had undergone some, stressful events, and I was not really bothered about my own health, and that also made me realize that if I start taking some small changes and things like that, as you get older, you are more, your body is more accustomed to adapt to those changes, or things like that. So that's what made me the change, that going from an acute illness stage to more of a preventive health. And
so it's more of a personal experience.
yes,
That's lovely. So let's talk more about Transcend, Doctor. When you decided to build this platform, what did you feel was missing in the way people experience healthcare and longevity, and here in the region and globally?
Well, like I mentioned, the purpose of Transcend is because longevity is growing rapidly. And it has become more of a buzzword than actually understanding what longevity is. Everybody wants to do longevity. There are different protocols of longevity, or there are different parts of longevity, as simple as a nutritional diet to extensive plasma filtration. So, and it's quite fragmented. Different people offer different things and all that stuff. But to get everything together and to understand what is best for our clients is something which is still fragmented and confusing around the region, And that's where we try to build the platform, or a kind of an ecosystem where we say that, yes, come in, let's monitor you, whether it's by your biomarkers or your needs, and then give you the right options with.
And a lot of people today feel overwhelmed. There's information coming from everywhere, but very little clarity. When someone first comes across Transcend, what actually happens, and how do you help them from confusion to a long-term goal, a long-term plan?
Like I said, we try to understand the need for it. Why is somebody looking for longevity? Is it just to have a good vitality? Is it somebody who has experienced a health issue and wants to prevent it, or wants to make sure he doesn't have another health problem, wants to treat that problem in a different approach? Or is it somebody who's just interested to understand what is longevity and all that stuff? So first of all is that we listen to them. We also take care of we do a complete, if they have a biomarker screening, we look at that. If not, we recommend them to do what kind of biomarkers are required. And based on that, we have a discussion and what's the next step for that.
So Doctor, if you had to explain Transcend's approach to longevity in 3 simple ideas, what would they be?
In 3 simple ideas, what we will put it into is 3 categories: that start, assess, and elevate. So start is, you've got to start the thought and the process of longevity and what longevity is. Understanding that and starting the process is the most important part of that. Second is assessing. Assess yourself. Where we differentiate wellness from longevity is that wellness is something which you will try and do it, a lot of buzzword, but longevity is trying to identify your biomarkers and then taking it ahead from then. So assessment is another key step. And then is elevate. So based on your reports in a lab, you need to see how you're going to elevate your vitality. How are you going to elevate your health span?
Very nice way you put it.
Yes.
So Transcend Healthcare came on board as a sponsor for a partner in the Revive Me conference. What made you feel this was the right platform and community for Transcend to associate with?
Revive Me has made an initiative of putting up longevity and things over there. And I think it's one of the first few to start in Abu Dhabi and in the region. So obviously, as Transcend, to always like to partner with people who are into this space of longevity and all that stuff. And then with a lot of communications with Revive and the people coming on that platform, made us feel that it is the right place to get connected with and to meet a lot of people and network with the right people in the space of longevity.
Awesome. Yeah. So Revive Me is positioned in the region's premier platform for health, longevity, biotech, innovation, regenerative medicine, and health tech. From your perspective, why is it important to have a dedicated ecosystem hub in the Middle East region?
Developing the ecosystem is right. Like I said, a client needs to understand that what all is there for him. Mm-hmm. So when you have the right ecosystem from when I started off from starting point to assessing them and to elevating, so all 3, everybody is doing great in the same field. Like you just talked about genetic testing and all that stuff. They are good in that. But then taking the results of the genetic testing, assessing it, and giving the right information to the client, and then working on it. So there are 3 different journey levels over there. And when we have them integrated or have an ecosystem helping you to do that, that's what helps them, And as you said, Revive Me brings all of those people into it, and with technology in, definitely
brings everyone together.
Yes.
So across the 2 days of Revive Me, you met clinicians, investors, wellness operators, and innovators. Is there one conversation or moment at Revive Me that stood out for you since the event?
I mean, I wouldn't say one thing. It was a lot of people meeting in different fields. Like we spoke to people who were interested in corporate wellness. We were also interested to see international companies coming and representing them. Some of the startups was brilliant, whether it was nutraceuticals or whether it was plasmapheresis or things like that. Some kind of diagnostics or treatment platforms which were new to us was introduced in Revive Me. And I could say, I can't label any one of them, but I would say a lot of them over there.
A lot of great conversations you had there with it. If you had to describe Revive Me 2025 experience in 3 words, what would they be, and why those 3?
In 3 words, I would say that we would sponsor it again in 2026. Yes, it was good.
Speaking of 2026, since we're in the new year, what's Transcend's goal for longevity this year?
Well, for us, to longevity is to expand our ecosystem, is to bring in more providers into our platform so that we can help our clients and more people to be aware of longevity, what is happening around within this country, within the region, and within the world. So that is our goal for 2026, to educate people on longevity, what exactly is longevity, and to guide them to the right plan.
So how would you approach that? Through conferences? How would you tap into that?
Yes, Martin, like you said, our ecosystem does include through conferences to meet more providers and partners. And then we also would like to do some events and workshops for our direct clients to make them aware of what longevity is and how should they start their journey.
Absolutely.
Good.
Looking forward to hearing more great things about that, Doctor.
Thank you.
If you could ask every busy professional person in Dubai to make a mindset shift about prevention and aging, what would that be for you?
I'm going to definitely tell them to pause, because we all are busy. Everybody has got their own priorities. But I would say that taking a step in longevity and prevention is not a big thing. Some small, simple steps is the first step to start with, which is to pause and reflect, and then start by assessing yourself. And that is the first step you should take it.
So that's for busy professionals. How about for clinicians? What would you advise?
Well, for clinicians, I always say that longevity is not something which is a one-time stop. It's a long-term commitment with your client, and longevity is continuity of care also. So we should keep that in mind and take.
Absolutely, Doctor. Great suggestions, by the way.
Thank you.
So, Doctor, in your practice, what are some of the key diagnostics or biomarkers you rely on to detect risk early and design highly personalized longevity strategies?
Well, in my practice, the first step obviously is to detect the inflammatory markers, because we see a chronic inflammation does cause aging and all that stuff. So I think that is the foremost first step which I start with, doing a biomarker testing with them, and which must include their inflammatory markers. Yeah.
And as we said before, for the busy person who's watching us and says, well, I don't have time, what are 3 simple science-backed actions they can start this month to improve their health span for the rest of their lives?
Well, if they can't stop and they're very busy to even test their biomarkers, then start with their nutrition, movement, and sleep. These are the 3 things they need to follow up. Watch what you're eating, keep moving, because movement is important. Your muscle is the most important longevity organ. And the third one is going to be so you got to sleep well.
I know sleep is a big thing. They always say sleep is the true medicine to resetting. So a lot of people, I think, undermine sleep in Dubai or UAE as a whole, because I know sleep is the true medicine.
Yes.
I always heard the saying, good night before midnight, because truly sleep resets your body.
Right.
Actually, just a quick question. What are some, sleep strategies you recommend someone to wind down before sleeping? From your idea or your perspective?
Well, have a meal couple of hours before you're asleep. Don't go on a full stomach. Stay away from phone and lights at least an hour before you go to sleep. Make sure the room is quite cool and pleasant. So that also helps you in getting your deep sleep and things like that. So those are the three.
And also, maybe like 3 hours or 4 hours before sleeping, they should have their last meal, right?
Well, it's not 3 to 4 hours, at least a couple of hours, 2 hours at least.
What about these lights people put in the room, like red light or something? Like, what do you think of those? Are those longevity practiced or for sleep or anything?
Well, we say that obviously no blue light or
blue lights.
Yeah, blue lights over there. But obviously, it depends on personal feelings. But at least no light is good. The darker the room, the better it is.
Complete darkness.
Yes.
I truly agree with you, doctor. I'm gonna start practicing that myself then. So, doctor, what does this next chapter of Transcend look like? And are there specific services or technologies or collaborations particularly excited about as you scale your concierge and consultancy model?
Well, I'm a strong believer of longevity retreats. I feel that when people love to travel, I myself like to travel. So, and then when we include longevity entails, and then once you travel, you're outside, you're away from your busy schedule, and you're dedicated for those few days. And I think that's the best time to start your longevity journey. So I believe that in 2026, we'll try to concentrate. And there are a lot of longevity retreats, medical longevity retreats coming up around the globe. And they're doing fantastic work. So we want to collaborate with them and see how we can offer this to our clients around this region and customize it and make it well so they have this longevity journey well planned.
That's awesome, doctor.
Yes.
And last but not least, to close, what is one message you like every Revive Me attendee, partner, and future participant to remember when they think about their health journey?
My take-home message will go back to the same: start, assess, and elevate. You need to start, you need to pause and reflect at yourself and then start your journey on longevity. Then assess. Like I said, longevity is incomplete without assessing yourself. That is checking your biomarkers and then planning your journey ahead. And then you go to elevate. You go to elevate your vitality, you go to elevate your mental status and everything. And that's the journey of longevity so that you can have a better health span.
So Dr. Sajid, thank you so much for sharing your insights and for being an integral part of Revive Me. To everyone watching, thank you for joining us in this amazing episode. For more conversations with leaders shaping the future of longevity and health tech, please follow Revive Me and stay tuned for our next episode. Thank you very much.